Good morning, class. Today I will present to you information on radiation sickness. Radiation is energy that is released from atoms. It can either be released in a form of wave patterns or in tiny particles of matter. Exposure to radiation can vary from low to high dose. An example of low-dose exposure is an X-ray examination. Low-dose exposure is supposedly not harmful to humans due to the minimal degrees of which we are exposed. However, high doses of radiation can have devastating effects to the human body. Radiation sickness occurs when high amounts of radioactive energy are released. High levels of radiation are commonly found in nuclear power plants, radioactive devices, and testing facilities that possess nuclear energy. Once the high energy is released into the body, it destroys cells in the body, such as blood cell producing cells of the bone marrow and the lining of the intestinal tract, including the stomach. High levels of radiation can also cause damage to the integumentary system, causing skin lesions, burns, premature aging, and even cancer. Signs and symptoms of high-dose radiation sickness are nausea and vomiting, dizziness and disorientation, infections, bloody vomit stools, headaches and fatigue, weakness, low blood pressure, skin lesions, fever, hair loss, diarrhea, and poor wound healing. Treatment for high levels of radiation include decontamination, which is the removal of as much external radioactive particles as possible. This includes discarding contaminated clothing, shoes, and any other sources that contain radioactive particles. The patient's body is also decontaminated by gently washing the skin with soap and water to remove loose radiation particles from the skin. The patient is also given a protein called granulocytes to promote white blood cell growth and counter the effects of radiation sickness in the bone marrow in efforts to help prevent further infections. Potassium iodide is also given to assist in thyroid function in efforts to counteract any absorption of radioiodine, which is iodine produced in the thyroid but contaminated with radiation. A drug called Prussian blue is also given to speed up the process of defecating radioactive particles, and DTPA is given to bind to the particles and allow them to pass in urination. Supportive treatment is also given for basic symptoms previously listed, such as headaches, fever, diarrhea, nausea, and vomiting, in addition to burns, dehydration, and bacterial infections. If a person is exposed to large doses of radiations with levels of 6 GY or greater, there is little chance for recovery, so end-of-life care is given. Death can occur within 2 days or 2 weeks, so during this time, patient care in a form of hospice care is given along with psychological and pastoral care. And this concludes information on radiation sickness.